MyPeBS, My Personal Breast Screening. MyPeBS is a clinical research study testing if it is at least equivalent, or even better, for women to have personalised breast cancer screening based on their individual risk of developing a breast cancer instead of standard screening based on age. To answer this question, we are comparing two screening strategies: the current standard screening in our countries, where age is the only factor considered when inviting women to mammography screening, and a personalised screening strategy, in which how and how often to screen is decided on the basis of individual risk level. Because not all women are the same, everyone's risk of developing breast cancer is different, depending on genetic factors, density of breast tissue, family and health history. MyPeBS is currently recruiting volunteers. We'd like you to consider joining this study. If you decide to join the study, after getting all information and reading the information sheet, we will ask you to sign an informed consent form and to answer some questions on your medical history, family cancer history, and reproductive history. Then, you will be randomly assigned by a computer to one of the two study groups: the standard screening group or the personalised screening group. The chances of being in either group is 50-50, just like the flip of a coin. If you are assigned to the standard screening group, you will follow your screening schedule according to current breast screening practices in your country and area. If you are assigned to the personalised screening group, we will ask you to give a sample of your saliva to analyse your DNA. This analysis will take 2 to 3 months, and we will assess the density of your breast through your screening mammography. MyPeBS researchers will estimate your risk on the basis of the results of these tests, along with the questionnaires you completed at study entry, and will recommend you a specific screening protocol according to your risk level. If your risk is low, your next mammography will be in 4 years at the end of the study. If your risk is average, you will have 1 mammogram every 2 years, and also 1 ultrasound every 2 years if your breast tissue is dense. If your risk is high, you will have a mammogram every year, and also 1 ultrasound every year if your breast tissue is dense. If your risk is very high, you will have a mammogram every year and a magnetic resonance imaging scan every year until you are 60. Your participation in the study will last 4 years. During this period, we will ask you to follow your screening protocol, to update your information once a year, so that we can check if your risk needs to be reassessed, and to give some feedback about any concern you may have and your point of view and thoughts on MyPeBS. You will be able to give us this feedback on your personal portal on MyPeBS web platform. By taking part, you would help to define the best way to screen for breast cancer and potentially improve screening guidelines for all women in the future.